The hottest trend in skincare right now is something called skin cycling, a program developed by New York City dermatologist Bowe, and she released it on a social media platform. That platform, coupled with her credibility as a board-certified dermatologist, allowed that program to go viral, exposing it to a lot of people, millions of them, in a very short amount of time. Hi, I'm Dr. Messina. Today we're going to be reviewing exactly what skin cycling is. And we're going to find out why Dr. Bowe thought it was necessary to introduce such a program. And finally, we're going to review and decide, is it a helpful thing? Will it help the masses, or will it be no use at all? Skin cycling is not new. We've been doing it in medicine for a number of years. Dr. Bowe's kind of coined the phrase, which I think is a kind of a cute, catchy phrase myself. We would do it if we had, let's say, a young teenager coming in with acne. We want to put them on Retinoid, but we know it's going to cause inflammation. I also know I have a young patient who's embarrassed and humiliated by his breakouts. Now to add inflammation to it is just going to make things worse. So we might tell that patient, do it every third night. Then a few weeks later, every other night. And then finally work your way up to nightly administration of your Retinoid. That's really skin cycling. Dr. Bowe made a very nice, easy to follow 4-step program. The mornings are always the same. You're going to cleanse, antioxidant, moisturizer, and sunscreen. It's the evenings and the night treatments that are going to change. On the first night, you're going to exfoliate. The second night, a retinoid. The third night, you're going to recover with a moisturizer. And the fourth night, you're going to recover with a moisturizer. Therefore, you're only using the retinoid once every 4 days. What that's going to allow is for you to get some skin rejuvenation without having the downtime. And that's important because the type of skincare that we adhere to tends to be the type of skincare that doesn't have a lot of downtime and doesn't really affect your quality of living. So why did Dr. Bowe create this program? Well, like many of us in the aesthetic field, she noticed that patients were suddenly coming in with a lot of inflammation, a lot of irritation, and it was secondary to all of the skincare products they were using. I blame this on the way people get their medical information these days. It used to be they would look in a magazine and they would find the product they would like. Then they would have to seek it out and see if any stores in town had it, and a lot of time would go by. However, these days we have skinfluencers all over the internet, and I think these skinfluencers at heart really mean well. However, they don't have the medical knowledge to understand the nuances and how one product might interact with another product, and how some products might not be compatible with specific medical conditions. And these skinfluencers are excellent in selling their products. They talk to you with a gleam in their eye and a lot of gusto in their voice, and it makes you think, God, I have to get this right away or I'm missing out on something. And with a few clicks of a mouse, it gets delivered to your house right away. A majority of her patients were taking these products basically aimlessly. They had no idea really of what they did or how they interact with each other. They just basically saw a product, thought this was grand, purchased it, and started using it until they had a huge arsenal of products. Now in my office recently, somebody came in with a lot of irritation. And I say, please bring in all the products you use on a daily basis. And I found that the wash had salicylic acid in it. The toner had glycolic acid in it. She was using an exfoliator, azelaic acid, and taking a retinoid at night. So we basically had 4 different types of exfoliants going on every day. And it was way too much for the skin. Now the fact that it's on the internet leads to a few problems. First of all, Dr. Google gives a lot of misinformation. And I saw some misinformation. One thing said, if you're not skin cycling, you're not doing your skincare correctly. Another said, this is the only way to keep inflammation down. That's not true. And I'm going to tell you in a few moments how you could keep inflammation down. In fact, I have 2 videos out on that regarding Retin-A and how to survive dryness and how to survive the purge, and which retinoid is best for you. So now let's break it down step by step. Your cleanser should be pure. It shouldn't have fragrances. It shouldn't have deodorant in it. It shouldn't have alcohol in it. And you should cleanse the skin once, maybe twice a day. Now let's discuss the exfoliants. We have 2 types. First, we have physical exfoliation, which is usually with a gritty type substance, or it's not practical, mechanical, using, like, say, a microdermabrasion. And chemical. Chemical is the preferred method because it goes on even and it's more predictable. And when it comes to chemical exfoliation, we have alpha acids, which are glycolic acid and lactic acid. We have beta acids, which would be salicylic acid, found in many, many products that exfoliate. Then we have polyhydroxyl acids that tend to be a little more skin sensitive. And when we get to the retinoid phase, that's where a lot of variability comes in. We have really 3 choices. We have retinol, which is found in many cosmetics, and it has to be converted to retinoic acid to become active. And that's a 2-step process. It goes from retinol to retinaldehyde to retinoic acid. And unfortunately, only 5% actually makes it to retinoic acid. So retinol is your weakest one. It's also the least likely to give you any irritation, and it's found in the majority of your cosmetics. The problem with that is that it's extremely variable. What's in one cosmetic might be a better retinol than in another cosmetic, or you might have a higher concentration in one brand than another. So there's really too much variability when dealing with a retinol. Retinaldehyde is 1 step stronger. It only has to be converted 1 step to get to retinoic acid. And retinaldehydes, again, are over the counter. The most potent of the retinoids is the retinoic acid, or tretinoin. We have Retin-A. The retinoic acids, like tretinoin, are all prescription strength. Therefore, you're prescribed a very specific dose. So there's a lot more accuracy when using them. There's also a lot more potency. And you have to be very careful with them when you're using an exfoliant as well. Exfoliants should only be used once or twice a week if you're using a nightly retinoid. And after that 2nd night, when you've applied your retinoids, the 3rd night is going to be recover with a moisturizer. And the 4th night, recover with a moisturizer. Therefore, you're using your exfoliant and your retinoid only once every 4 days. And because the retinoid is only going to be used once every 4th night, it leads to a lot of gray area as to does it work or not. In order for medications to work, we have to have a steady state level. And I don't think you're going to get that steady state level by using it once every 4th night. What I mean is when we put on an agent, even a topical agent, people forget that transdermal absorption is a real thing. And you can get a lot of medication in simply by putting it on the skin. So when you put your retinoid on, you get a very high level. And then by using it every day, you tend to peak and stay that way. That's where you get your clinical effects. Now, if you just do it once, you're going to get a high peak, and then it's going to sharply drop off. And then day 2, 3, 4, then the peak, then drop off. 2, 3, 4, and so forth. And having that short peak, is it going to be enough to give you any appreciable difference? That's going to depend on what you're shooting for. If you were trying to treat acne, definitely not. If you were looking for simple rejuvenation, it might, but it's going to slow things down a lot. It's going to take a long time for you to develop the clinical effects that you're looking for, just because you don't have that steady state of retinoid in your skin. The other concern is all of the studies that were done on retinoids and the benefits for the skin were done using it on a nightly basis. And when I'm talking about benefits, I'm going beyond fine lines and wrinkles. I'm talking about removing sun damage, and more importantly, and I think most importantly, preventing the development of premalignant skin lesions. And that was all studied on a nightly basis administration, so I doubt that using it once every fourth night will give you that benefit. And there are many ways we could reduce the inflammation from retinoids. First, we could go to a lower strength, or we could try a different vehicle. Go from a gel to a cream. Or you could try a later generation. So who would this program be good for? I personally think it would be an excellent choice for the people who are not actively involved in skincare yet, who are fearful of getting a lot of irritation or inflammation. And if you don't think that exists, try to convince a person who's never done skincare before to get a chemical peel. They're going to tell you, I don't want that acid on my face. It's going to go right down to my skull bones. And it doesn't. But there's a fear out there. I think those people in particular would really benefit from this skin cycling program to at least get them started into a skincare routine. I think people that have very sensitive skin also will benefit. Conversely, if you are already actively involved in a skin program and you were doing retinoids nightly and you were doing very well with it, I think if you start skin cycling at this point, you'll do yourself a disservice. You won't be getting enough of any one of the products. I hope I gave you enough information to understand exactly what skin cycling is. If not, my comments are always open. You could ask me and I definitely will answer you back. If you like my information, click the bell and hit subscribe for my future videos.